I'm Bruce Steinberg, a specialist in the upper extremity at the Jacksonville Orthopedic Institute. I diagnose and treat all problems ranging from the fingertips to the shoulder, skin to bones. Today, I would like to talk to you about shoulder pain, which can be a sign of rotator cuff tears. Pain, weakness, clicking, popping in the shoulder area are common symptoms of a rotator cuff tear. Tears of the rotator cuff can occur in individuals of all ages. A single heavy lifting event is the usual cause for a younger patient, while older patients may injure the rotator cuff with minimal force. As we get older, the rotator cuff may weaken and fray if bone spurs form within the shoulder. This is a diagram of the shoulder. The ball and socket joint meet under the shoulder blade and collarbone. We're able to move our shoulders with the help of the big outer muscle, the deltoid. The smaller, very important inside muscles of the rotator cuff, depicted here, also move the shoulder. The rotator cuff muscle is called the supraspinatus. This muscle typically inserts at the top of the humerus bone. As the arm is lifted, the rotator cuff tendon may rub against the bone spur of the shoulder blade. With progressive fraying and use, the rotator cuff muscle, which acts like a spring, pulls the tendon away from the bone, which in turn creates a tear. Once the rotator cuff tear occurs, the muscle pulls on the tendon, retracting it away from its insertion and extending the tear through the remaining tendon. Minimally invasive techniques have been developed to repair the rotator cuff and remove bone spurs as well as arthritis within the shoulder. A fiber optic camera is introduced through the shoulder joint through a small puncture. Through a second puncture, we can place instruments to place anchors into the bone. Sutures arising from those anchors are weaved through the rotator cuff tendon. Special knots tied to cinch down the tendon bring the tendon back to the bone. Those suture limbs are then placed into bone as well. This advanced technique that I utilize as part of my practice has proven to be an extremely effective option for repairing rotator cuff tears while also minimizing the recovery time. Similar techniques are used for other shoulder problems such as shoulder instability from labral tears. I have performed advanced arthroscopic shoulder surgery over 1,500 times with excellent results. If you would like to know more about rotator cuff tears and shoulder problems, or read about what my patients have to say about their experiences, I invite you to visit other sections of my website.